Hi, I'm Josh Jacob, consultant operating surgeon. This is my colleague, Mr. Ashwin Unithan, and we are here at the celebrious operating theatre of PMI Runnymede Hospital. Today, we're going to talk on ankle fractures. Now, that's not a very common injury. Maybe you never experienced it, but it's a very bread and butter operation that we're involved in, and often patients who walk through our A&Es come with ankle fractures. Now, it can start as a very innocuous injury, just a trip over the curb, or a nasty injury as a result of a tackle or coming off a motorbike. And lo and behold, the ankle is fractured as seen in the A&E. And what exactly is an ankle fracture, Mr. Unithan?
So, our ankle has got a big bone called the tibia, a small bone called the fibula, and then you have your foot which you walk on. So, majority of the ankle fractures happen when you have cracked a bone in your fibula, like this. Ouch! Did I break it or was it broken before?
That was broken.
Oh, okay, all right. So sorry. Okay, it's what we call as a fibular fracture. Now, a fibular fracture can be of various varieties. On orthopedics, we like 3 numbers, so it's 1, 2, and 3, of which 3 is higher up, 2 is in the middle, and 1 is at the lower tip. Now, the treatment varies from what kind of a fracture it is, and also treatment varies on what was the kind of injury you had, and hence the history is quite crucial for us to understand that. So, Mr. Jacob, would you want to talk about the first 2 types of fractures? Like we call the fractures are called Weber A, Weber B, Weber C.
Yes, so the fractures that involve just the tip of this little bone called the fibula is pretty much a sprain, a glorified sprain. Often the ligament gets torn along with a sliver of bone, and we treat it like a sprain. And so if you have come to us or to your surgeon, you'll be given a boot with which you can walk. The key to your recovery, again a ballpark figure of 6 weeks, is to make sure your ankle is supple and pliable and it doesn't get stiff. So the physiotherapist will get involved in your treatment around about 2 or 3 weeks, but you're allowed to start mobilizing your ankle even before they actually see you. The boot is pretty much there to walk on, but not when you're lying down or sitting in a chair enjoying reading a book or watching a telly.
And also the simple advice about rice is quite useful here, and what we normally advise patients is walk as pain allows. You might not want to put full weight for the first week or 2, but then you would want to put your full weight, but use your common sense and put weight as pain allows.
Now, if it is the second type, which is what we call Weber B, that is a little more involved. The fracture goes somewhere at this height, and it may also involve a bone, the bigger bone called the medial malleolus, this being the lateral malleolus. Now, if both of them are gone, we want to check whether your ankle is stable. By definition, your ankle is perceived to be unstable, and we will confirm that with a particular X-ray where we make you stand and take an X-ray from the front. And if the bone that is in between here, which is not in the picture, if that has displaced, then we would confer instability to the fracture, and we would expect that we will have a discussion about treating this fracture with a surgical fixation, generally involving plates and screws.
Yeah, so the surgical fixations of ankle fractures depends on whether you have got the outside and the inside of your ankle broken, or the outside alone, and you'll have either plates on both sides or plates and screws. Generally, they are not that complicated surgeries to do. It takes about, in my hand, about 45 minutes altogether to do the surgery. You will wake up with a bit of pain on the inside and the outside, depending upon where the fracture, what kind of fixation has been done. We put a lot of local in that. You will have, in my practice, and I'm sure Mr. Jacob also does that, I put them in a plaster for 2 weeks, so the wound will heal, and then can be put in a walking boot and mobilized as pain allows.
Absolutely, yes. Again, the key to fixing the ankle fractures are so that you get moving as soon as possible, because these fractures are at a high risk of developing clots either below the knee, or they can spread rapidly to the lung, and that can result in a fatality, although it's a very small incidence of fatality. But ankle fractures should be treated with caution, and we expect that by walking you'll be using your calf muscles, thereby preventing or delaying rapidly spreading clots to your lung.